Good morning. Oh, afternoon, right? Good afternoon, everybody. My fellow First Ladies, my sisters. Since yesterday till today, it feels like we have the same mother. It feels like a family to me. It's so nice to have you here in Tanzania. I promise I'll do my level best to come to your countries too, to see what you really do. I also have a short video. I think it's best if we watch it first, then I will come back to that. But before that, I would like to take this opportunity to thank Merck Foundation, first of all, for inviting me. I must say I had another commitment, but I had to break it for this meeting. I thought maybe I would just give my video and be missed, but then it did not feel right for 14 great women of Africa to be in my country and I'm not there. So I gave you the preference. And secondly, also, I would like to say thank you again for convening this meeting in Tanzania. It has been our pleasure, and I also, of course, grateful to my president, Dr. Samia Suluhu Hassan, for hosting everybody, for making this happen. And also I want to commend all of you First Ladies for the great work that you do in your countries. I know I'm in your shoes. We are wearing the same shoes that we are seen as mothers. We have to give solutions to their problems, and sometimes it's so difficult because of financial constraints. As First Lady's office, like I'm talking for myself, it's not like I have set aside a budget to do anything, but I have to struggle to make ends meet. But we are in there and doing it for our women, children, and the society in general. Thank you. We can watch.
Zanzibar, comprising Unguja and Pemba Island, covers a total area of 2,654 square kilometers and is a home to 1.9 million people. The labor force participation rate is 79%, and in terms of job creation, seaweed production ranks the second after tourism and cloves, with over 90% of seaweed farmers being female. Despite 100% Zanzibari households being located within 5 kilometers of primary health care facilities, maternal mortality rate remains high at 145 deaths per 100,000 live births, and out of 1,000 live births, 56 children die before the age of 5. Only 28% of adolescents have adequate knowledge of menstrual health and hygiene, with many having limited access to sanitary pads. While 67% of households have at least 3 meals a day, there are significant gap in nutritional habits, and malnutrition remains a challenge. The average children's stunting rate across Zanzibar is 17%. Recognizing that a revolutionary government of Zanzibar welcomed complementary efforts to address the stated national challenges, Her Excellency Mrs. MARIYAM MWINYI, the First Lady of Zanzibar, was inspired to establish the Zanzibar Maisha Bora Foundation in July 2021 as the founder and chairperson of the board of the foundation. The Zanzibar Maisha Bora Foundation drives efforts to improve the health, well-being, and safety of women, youth, and children in Zanzibar. Through its 3-year strategic plan from 2022 to 2025, the foundation has continuously aligned its work with both the global and Zanzibar national development frameworks by achieving 4 goals. Our first strategic goal is to improve livelihoods of women and youth seaweed farmers. Over the past 3 years, we have empowered more than 1,000 women and youth in local communities by training farmers and have established nursery centers to produce high-quality seedlings by developing breeding programs. Currently, we are setting up a state-of-the-art seaweed social enterprise program in collaboration with the Ministry of Blue Economy and Fisheries to horizontally commercialize the seaweed initiative into a competitive industry that will sustainably benefit at least 1,500 local women and youth. Through innovative marketing and nutritional strategies, we are strengthening this vital seaweed industry for economic growth and nutritional security. Whilst we have integrated seaweed research into nutrition programs, we have also registered positive impact of integrating seaweed into community-driven solutions, and gradually improvement of women, youth, and children's health are notable in Zanzibar. As from 2021, the First Lady Mama MARIYAM MWINYI has championed a homegrown Tumaini initiative, which accommodates a small-scale production industry of reusable hygiene pads, thus enhancing access to menstrual health of about 5,000 adolescents and young girls. This is one of environmentally friendly and cost-effective model in improving adolescent sexual and reproductive health for in and out of school population segment. With her passion on healthy lifestyle, Her Excellence Mrs. MARIYAM MWINYI in year 2021 conceived a flagship program known as MARIYAM MWINYI Walkathon, which began with the 5 kilometers monthly walks together with the communities. Since October 2023, in collaboration with the Ministry of Health Zanzibar, the walkathon has been tagged with the quarterly Afya Bora Maisha Bora campaign that entails medical camps that offer reproductive, maternal, child, and youth health services, including specialized services such as oncology and cardiac services, which has reached more than 17,000 people. Our efforts towards reducing stunting and maternal mortality rate caused by malnutrition and anemia through our nutrition initiatives, such as Village Health and Nutrition Days, we have reached more than 12,000 people with information, education, and services in nutritional issues, maternal health, antenatal care, and family planning, whereas about 5,000 children were vaccinated through integrated routine immunization. We have actively engaged and worked with more than 150 community health workers who are essential in delivering health, education, and services in communities, whereby they conduct screening for nutrition amongst the under 5 children and continue to identify first clinic referrals for pregnant women. Our third strategic goal is to create an enhanced safe environment to protect adolescent girls and boys against gender-based violence. In March 2024, we launched the Zanzibar Says No More campaign under stewardship of Commonwealth Secretariat, graced by Right Honourable Patricia Scotland KC, Secretary General of Commonwealth, in recognition of integrating gender-based violence as a health concern. This campaign aims to create awareness and combat domestic and sexual violence against women and children in Zanzibar. In collaboration with the Ministry of Community Development, Gender, Elderly and Children, the Foundation have co-designed the Zanzibar Gender-Based Violence Case Management Information System, which is an integrated system aiming to streamline data management, providing accurate information on gender-based violence cases and services, supporting better decision-making and strategic planning. The Zanzibar Maisha Bora Foundation is further committed in combating gender-based violence by setting up a rehabilitation center or a safe house in Zanzibar to provide post-gender-based violence services to the survivors, such as psychosocial support, legal aid, and livelihood skills to women, which will facilitate economic independence as they gradually integrate in their respective communities. Our fourth strategic goal is to build and enrich Zanzibar Maisha Bora Foundation performance and sustainability, whereas we continue reinforcing our internal frameworks, structure, and system for high excellence in performance. We further appreciate and encourage partnerships with the different stakeholders ranging from governments, development partners, donors, philanthropists, and fellow local and international organizations to expand our reach and create sustainable quality life to all the Zanzibaris. Under the leadership of Her Excellency Mrs. MARIYAM MWINYI, Zanzibar Foundation is driving meaningful change for a brighter future for all. You are welcome to be part of our journey.
And I think we're going to walk with you in the marathon next time. So, and of course, we're looking forward to start our partnership and with Merck Foundation and your foundation, Your Excellency. It will be great to also add value with you and make it a great success together.
Thank you very much. That is what you saw is what Zanzibar Maisha Bora Foundation is doing. In a nutshell, it is within 3 core areas. That is economic empowerment, as we have seen for this seaweed women farmers. And you would ask why seaweed farmers, because 90% of seaweed farmers in Zanzibar are women. And I wanted to empower women. So that was a bigger group for me to pick. And of course, it was in line with the blue economy agenda of Zanzibar. So women of Zanzibar contributing greatly to the blue economy agenda. Secondly, it's within health, as you have seen. We are dealing with health of women, children, newborn, and adolescents, in the sense that also nutrition is also one of our agenda within the health component. But the best part is when we do our camp, as you said, as you have seen the free camp, we are doing everything in that camp. It's normally very big, from doing the medical part of it, but to education part of nutrition, HIV, AIDS. We go to every aspect, cancers, and doing all the screening. Because what we believe in, first of all, we do physical activity, meaning we want to prevent those non-communicable diseases by regular doing exercises. But secondly, early detection for our screening, we are telling them, and also the habit of doing medical checkup. We are instilling these values to our people. But then there are those that have already gotten the problem. Early detection is good, and we do also specialized treatment to them and referrals, as I explained also yesterday. We also do that because we work closely with the Ministry of Health. So we do all the referrals. This is also another area I would see we can easily go in with the Merck Foundation. I feel like you are falling into my my choice of areas. I chose wisely because all economic empowerment, health, and gender-based violence, you just fall in easily. I can't wait to see you come in and give scholarship to our doctors. And another important issue I wanted to talk about is you're coming in the right time, because our government, our president has built a lot of hospitals, 11 big hospitals within these 3 years. 10 districts, all districts have now district hospitals in Zanzibar, and we have regional hospital, one state-of-the-art, I must say. One is ready, but the others are coming. We need manpower, we need health workers, we need specialized. These hospitals are equipped with theaters, with modern equipments, but yet to have qualified people to serve in those hospitals. We need even nurses, everything.
Rely on us on this.
Thank you so much.
This is very important. You know, empowering and training doctors, for me, is very important, more important than anything. I believe that a good doctor in your life is more important than your family. This is what I believe 100%, especially, no, because Dr. Professor Frank, when you are ill, doctor in your family. Yes, it's better, yeah. Because, for example, when you are ill and you don't know what you have, and you cannot continue with your life, quality of life is so bad, and you go to doctors and they don't know how to diagnose you, how to treat you. It's very important to have a good doctor.
It is.
Yes, so thank you very, very much.
Yeah, I'm with you. Because we have malpractices, we have wrong diagnosis, you are treated for A, you have B, and thank you to that. And I think I forgot to mention, so far in Tanzania mainland, you have trained 70 doctors. Thank you very much.
Scholarships for Tanzanian doctors. We thank you very much also for empowering us to do that. And I was very proud to see them yesterday and these nice statues we had. It's really a very nice souvenir. Thank you very, very much for hosting us. And here I have to thank also Your Excellency, the First Lady of Zanzibar, Her Excellency Madame MARIYAM MWINYI, MARIYAM MWINYI, and of course the President of Tanzania, Her Excellency Dr. Samia Suluhu, for hosting all of us and make it a great success of this year conference, 11th edition. Thank you very much.